here. We're managing for acute G with treatment failure in RVD.
Actually, it's a chronic one, huh? She was already here 4 weeks ago. Winnie, this is a typical patient who went from one facility to another and got lost in between and finally came here to Homa Bay to get treatment. Winnie was put on ARVs 2 years ago when she was pregnant of her child. Then she was sent to a facility due to private problems. It didn't work out. Then she should be switched half a year ago to second line. Because of managing her treatment properly at the facilities, because of not presenting and changing facilities, she lost more or less 2 years and her condition got worse and worse.
Winnie was admitted to the AIDS ward in Homa Bay Hospital in Western Kenya with late-stage HIV. This means the virus has attacked her immune system, leaving her extremely vulnerable to infection. She's suffering from chronic gastroenteritis.
Is the right leg worse from the pain sensation?
In nearby beds are Quanta and Mulveen, and others like them, all in the same situation. Their stories are different, but together they reflect a largely ignored reality. At a time when antiretroviral drugs, ARVs, are in widespread use, AIDS continues to kill. In 2016, 1 million people died of the disease.
HIV patients are still dying to a big extent, like before the introduction of ARVs. ARV drugs are available, diagnostics are available. So the question is, why HIV patients are still dying?
Maintenant qu'on a mis plus de 15 millions de personnes sous ARV dans le monde, on s'aperçoit qu'on a une mortalité qui est liée au sida, qui est différente de ce qu'on avait il y a quelques années. C'est lié soit au fait que les gens aient interrompu leur traitement ou parce qu'ils sont en échec de leur traitement et qu'on n'arrive pas à dépister ces échecs assez rapidement.
For the medical team here in Homa Bay, patients whose treatment is failing need specially tailored care.
We see majority of them who already know their status, and the majority of them are already on ARVs. Either they have been on ARVs for a long time and they are failing, or they have been on ARVs and they defaulted, adherence problem, and therefore they have gotten opportunistic infections. And this is a challenge in the world.
The primary aim of most HIV programs today is to put as many people as possible on treatment. This is based on the principle that once tested and treated, they'll live for years without falling sick. But the reality is more complex. The journey ahead for people living with HIV is strewn with pitfalls. Take this woman, for example. Her husband chased her from her home.
Kurungi kaka nanya donja ot mondo akaw yath atemo minore mondo adonji obaya gi kite. Aduogo to ayudo be komera aduogo e ot to yedhe kaka achako akaw mana asebedo ng'at moro ma ok nyal naonge ngufu to mana atho gi e nungona kadok piny kocha.
Psychological and socio-economic issues, stigma, lack of information on the implications of taking treatment for life. The reasons for treatment interruption or failure are numerous.
Sama midekre onge to tije nitiyore mana kaka naseng'isi ni an bende ndalo mano miya yath mana konyora naparo nasechango nikech natiyo tijena. Ng'eyo nikech aparo ni samoro kisedhi maber to in kod paro ni samoro kore chango kuru ineno ni iber kaka joma moko koro ineno ni chango kare kia ni gicha to duoko mana teko gicha to kotieke flat.
Another obstacle, identifying patients whose treatment is failing. The main challenge here is to obtain results as fast as possible. To facilitate this, some tests can be carried out at the patient's bedside, point-of-care tools that not only assess the treatment's effectiveness, but also detect infections that can develop when the immune system is weakened. It is these infections that kill people in the advanced stages of HIV.
Et donc ce qu'il faut faire au départ, c'est accélérer le plus rapidement possible le dépistage de l'infection opportuniste. Et c'est pour ça qu'à MSF, on appelle aujourd'hui à la généralisation de nouveaux tests qui permettent d'accélérer le dépistage de la tuberculose ou d'accélérer le dépistage de la cryptococcose, qui sont deux des maladies, les infections opportunistes les plus fréquentes, pour mettre les patients les plus rapidement sous traitement.
As long as there are obstacles of this kind, the teams will continue to see gravely ill patients admitted to their wards, and many will die shortly after arriving. Medical care is a real challenge.
Il faut qu'on fasse trois choses à la fois, c'est-à-dire travailler sur des gens qui ont un état extrêmement faible au départ, dénutris, anémiés, qu'en plus il faut prendre en charge une infection très grave et de manière urgente, et il faut à la fois travailler sur le fait de reconstituer, de recréer les défenses immunitaires du patient. Et c'est ça la complexité dans des milieux où on a des ressources qui sont extrêmement limitées. C'est ça qui est associé à la mortalité absolument terrible qu'on voit encore à l'hôpital aujourd'hui.
There's another hidden side to AIDS. The sick who don't even manage to get to the hospital. Either they've never been tested for HIV or they've never had access to antiretrovirals. They remain out of sight and will highly likely die in their homes. Such cases are found in countries where HIV is less prevalent, for example in Central and Western Africa. Access to HIV treatment remains limited, and people die of AIDS as much as 15 years ago, when antiretrovirals weren't commonly available. In Central African Republic, there is very little access to testing and treatment for HIV.
Les patients viennent dans un état avancé de leur maladie parce que souvent, vu leur état, ils préféraient de rester à la maison parce qu'ils ne disposaient pas d'argent pour venir à l'hôpital. Au niveau du système de médecine ici, la capacité d'accueil elle est trop faible parce qu'on est obligé de libérer une patiente auquel il est un peu amélioré et de recevoir celui qui est dans un état vraiment grabataire.
In these countries, what's most urgently needed is not so much identifying treatment failures and possible opportunistic infections as combating high levels of stigma, setting up mass screening campaigns and providing widespread access to drugs.
We have to put her most probably on second line.
To prevent and treat AIDS, medical strategies have to be adapted to include improved diagnostic tools and more effective affordable drugs, and to actively help people living with HIV to overcome the obstacles and constraints related to lifelong treatment.